Statistics show that addiction affects over 48 million people in the U.S. today. Often, this is co-occurring with mental health issues such as depression, PTSD, anxiety, and other disorders. Research has shown that the best approach in treating addiction encompasses healing and restoring balance to the whole person, mind, body, and spirit. Addiction expert Paige Tuck explains.
Addiction often stems from deeper emotional and psychological wounds, so exploring these with the person so they can have a deeper understanding of maybe why they turned to substances when they didn't like the way that they felt or they couldn't cope with a certain situation, such as anxiety, depression, stress, grief, trauma, or just low self-worth. So when someone is struggling through addiction, they use substances or engage in behaviors and they become compulsive and continue despite harmful and hurtful consequences.
Here at Synergy, a recovery center with 2 locations in southwest Missouri, treatment focuses on the understanding that substances are a coping mechanism for deeper, underlying issues. It's an empowering approach that allows clients to have a better understanding of themselves and their interactions in the world, providing clients with the skills to help rebuild and sustain healthy connections with others.
We feel strongly that recovery requires a holistic approach to treatment. So we use research and our experience in the field to really design a program for all parts of an individual's physical and mental health in the healing process. We offer holistic health therapies, utilize the SMART recovery model, medicated assisted treatment, interventions for mental health, and trauma-informed practices, including EMDR, which really allows us to get to the root causes of addiction and focus on clients getting back to leading healthier lives.
We put a large emphasis on the connection with oneself and others. So often we find that the clients have been isolating and have damaged the relationship with their family and friends. And so learning how to heal and rebuild and sustain those relationships, as well as looking at codependency concerns and enabling behaviors, setting boundaries, and then communicating their wants and needs.
Gender-specific and small in size, the treatment programs at both Synergy Executive for Men and Synergy Recovery Center for Women create emotional safety and intimate connections within a group setting, which is an important aspect of the healing process.
Synergy Executive is a treatment facility designed specifically for men that are looking for a program that is in a comfortable home-like environment. The clients will participate in 52 hours of educational programming and experiential activities each week, along with holistics, which include things like acupuncture, cupping, massage, meditation, yoga. We also have an outdoor walking path and a pickleball court for the men to enjoy.
My life was just in chaos. I was in legal trouble. I was in all kinds of relational trouble. And for me, this was kind of pulling out all the stops coming into an inpatient program. The way that we were treated from the get-go was incredible. We were blown away, especially when we walk in and we saw the facility and we saw the staff and that they're in it for more than just a job, that they truly cared. I've never really experienced something so profound. Within the first 30 minutes that I was here, I think I realized that this was where I needed to be. I'm 4.5 years into this sobriety thing, and there's still so much work to be done, but I've seen impossible things become reality.
Synergy Recovery Center is a private women's residential treatment facility that allows women to have a unique experience in a trauma-informed setting that really promotes dignity, safety, and respect. Along with offering traditional evidence-based practices, we also have innovative therapies, including things like art therapy, music therapy, yoga, guided meditation, and somatic practices. Each client will engage in individual, family, and group therapy, and our client-counselor ratios are really small, which allows for the client to have a lot of connection and time with their counselor, typically meeting with them for 3 or 4 sessions each week.
I came to Synergy because my dependence on alcohol had really almost killed me. Synergy is about restoration and reparation, and what I learned here was that the brain is always growing and it can be retrained, and that we are capable of being transformed. And through the education I got here, the counseling and the kindness, I learned and really reworked my brain so that I could be sober. And it all happened here. It was such a positive, but very real, very honest environment. And Synergy was the absolute key. I would not be alive today if it weren't for Synergy.
Our stress response system is altered when we're kind of talking about the mind-body connection, and that in turn has a cascade of effects on our emotions, our behaviors, our thought processes, our perceptions of self, and the ability to connect to others. And then these are usually managed with substance abuse or other kind of harmful behavior. But we have to use a lot of talk therapy, art therapy, different modalities to help them understand that. When we experience something on an emotional and a social level, there are actually changes that happen for us internally, and those have to be healed just like anything else would physically. We need to take it just as seriously.
Understanding that residential treatment is only the first step in the recovery journey, Synergy begins focusing on the client's transition back home from the very beginning. Providing one-on-one assistance with aftercare planning, Synergy walks alongside clients and their families to offer resources and support to help individuals establish continuing care in their communities.
So from the time the client checks into treatment, we're making plans for them transitioning back home. And they meet one-on-one with our community support specialist to come up with a comprehensive plan. So when they return home, they have something to follow. And then we strongly encourage an outpatient program so the client can continue to learn about recovery and then master some of those coping skills, and then also be in a network of people doing the same thing that they're doing and managing life's obligations. We want people to know that recovery is possible, and when a client is ready and willing to do the work, they can regain back the lives that they were living. They can build confidence in themselves, repair relationships, and experience peace and happiness.
To find out more, please visit synergyrecoverycenter.com or synergyexecutive.com.